Hi, I'm Dr. Rahi Victory, a reproductive endocrinology and infertility specialist, board certified in Canada and the US. And today we are going to talk about the top 10 reasons that an IVF cycle can fail. So let's talk about number 10. The number 10 reason is that they did not diagnose you correctly. So if they miss the correct diagnosis and they're missing things like endometriosis, adenomyosis, a polyp or a fibroid in the wrong place, you can really end up getting the wrong fertility treatment or at the wrong time, or it's not properly optimized. So everything needs to be optimized for you. If you have endo, you need an endo-specific protocol. That may include things like Lupron or Viagara or letrozole FET protocol. So all of these things are really critical for you. Make sure you've got a full diagnosis. Simply being told that it's your age or that it's a problem with the unexplained category is not sufficient. You need to know specifically what your diagnosis is. Number 9, you didn't get enough monitoring. I know everybody doesn't necessarily love Wanda, but the reality is that getting the right amount of monitoring is really critical to your success. You need to make sure that you're getting enough ultrasounds and blood work to accurately determine how large the follicles are, when they're being matured, and when they're being triggered. I know a lot of programs that trigger strictly based on when you have the top 2 follicles reach a certain measure. The problem with that kind of cookie cutter approach is that if you have 2 follicles that are 17 and you have 2 follicles that are 13, waiting another day or 2 will not compromise the 17s, but will give you a chance to get those 13s to potentially become mature. So depending on how you are being monitored, you can much more accurately determine when to do your egg retrieval. And it's equally important when you're doing a frozen embryo transfer, because you really need to know exactly when to time the embryo transfer with the thickness of the lining, your hormones, and so on. So that's really critical. Number 8, you use the wrong progesterone. Time and time again, we have told people that it is critical to use those painful progesterone in oil shots and vaginal progesterone. Lots of studies now that support this. It's pretty much incontrovertible. You need both types of progesterone to achieve the highest levels of success. And if you're not being monitored for your progesterone levels, you may not have adequate progesterone levels, or you can actually have too much. So it's really important to make sure that your progesterone levels are checked and that you're on both types of progesterone, vaginal and progesterone in oil. Number 7, and this one's huge, wrong embryo transfer protocol. We've been using the letrozole protocol for over 2 years now, and a very recent study that is being published states very clearly that the letrozole protocol now is the favored protocol for frozen embryo transfers. Keeping your estrogen levels low is beneficial, and that's a big part of the reason that people favor frozen embryo transfers over fresh embryo transfers, because in a fresh, your estrogen levels are really high, and in a frozen, you can keep them much lower. So it's really important to try natural or letrozole-based protocol instead of a traditional hormone replacement therapy cycle. Those cycles have the lowest success rates and the highest miscarriage rates, so it's really critical that they choose the right frozen embryo transfer protocol for you. Number 6, maybe the lab didn't use all the tools at their disposal to optimize your embryo and blastocyst development. So there are some tools we can use. There's things like calcium ionophore oocyte activation. There are special media types like GM-CSF or Neupogen-based medias. Some of these are controversial. Some of them actually have success behind them and support for that in the literature. And there are other things as well. Does your lab have exceptional ICSI success rates? That's critical. If you can get a 90-95% fertilization rate, you should be doing ICSI, because you're going to get more of those eggs to turn into embryos and give them a chance of becoming blastocysts. If you don't have great ICSI rates, then you're going with conventional IVF, and the question then is, why don't you have great ICSI rates? So it's really important to make sure you're with a facility that can provide you with the highest efficiency for each egg that you can acquire, because sometimes you don't get very many and you want to give those eggs the very best chance that they can turn into a blastocyst. Number 5, bad lab techniques. So there are times where either we're not flushing to get the eggs out of you, or they're waiting too long before they do the IVF or the ICSI procedures. Maybe they're not using the latest and greatest technology or techniques. Perhaps they're still using traditional sort of stand-up oven incubators versus the benchtop incubators, or what we use, which is the time-lapse incubators. So if you don't have the right technique, if you're not using the ICSI like we just discussed, this can very significantly compromise your outcomes. Remember, we can pretty much train anyone to do our part of things as REs, but the lab is really critical, and having a good team with top-notch technology, top-notch lab, and top-notch equipment is really, really important. This is not something that just anybody can do. It's really critical that it be done well. Number 4, they did not use the right trigger. So there are different ways to trigger your eggs. The first way, and the traditional way, was just using HCG. We've moved away from that primarily now to avoid risks of ovarian hyperstimulation, and we moved more to using what's called a GnRH agonist trigger. The problem is the GnRH agonist trigger alone is not as good as using the GnRH agonist trigger with HCG. So you need what's called a double trigger, which is the GnRH agonist trigger on one hand and a small amount of HCG. And that HCG can be titrated to your estrogen levels and the number of eggs you have, so that you still avoid the risk of hyperstim, but get that added little benefit that HCG can provide. And this is actually true even when you're doing frozen embryo transfers. The HCG injection can actually affect what happens later on. So it does have an egg and embryo quality impact. And it's very, very important to get the double trigger for your cycles. Number 3, huge issue, the wrong stimulation duration. In other words, you either took the drugs for too short a period of time or you were on them for too long. I see this all the time from other centers. Patients stim for 6 days or 7 days, they got triggered. That is known to compromise the success rates. Or they were on drugs for 14, 15, 16 days, which again is known to compromise the outcomes. If you have to go more than 12 days, we know from studies, and we've presented this on our show before, that the reality is you're going to get a much decreased outcome in terms of success. And so it's really, really critical that you are stimming for somewhere ideally between 8 to 11 days. You can kind of go up to 12. We don't really like going beyond that if we can avoid it. Now, in some circumstances, you can't avoid it. And if it's unavoidable, that's a different story. But it's almost worth stopping and restarting if you have to, in order to get that duration to be shorter. And you can do that with different stimulation protocols, different medications, different approaches, pre-treatments, supplements, acupuncture, traditional Chinese medicine, all of those different things. Number 2, huge, huge, huge wrong protocol. Every patient requires their own individualized approach when they're doing IVF. If you just put every single patient on an antagonist protocol with one of the drugs, it's not going to work. Everybody is different. Every woman's body is different and unique. And so each woman needs to be looked at carefully to assess what they need specifically for themselves, rather than what's one size fits all. So if you have someone that's older, they may need letrozole in their protocol. They may need to have a microdose flare. They may want an antagonist. You may need a higher dose or potentially a much lower dose, depending on how weak the ovaries are. Sometimes when you have really weak ovaries, people tend to use loads and loads of meds. They are more and more now understanding that those high doses of medications can have a very negative impact on the actual competence of the egg and its ability to turn into a viable embryo. So you need to be individualized. A young patient probably can take kind of any protocol and still do well. But for specific groups of patients, those with diminished ovarian reserve, those who are older, PCOS patients, there are supplements you need to look at. There are vitamins you need to look at. There are adjunct treatments, including things like DHEA, human growth hormone, testosterone priming. All of these protocols are really, really critical. So you need to be individualized. If your clinic just applies one type of approach to every single patient, that's not going to work, guys. So make sure that you are getting individualized care where they actually know who you are, they know what your biology is, and they have tailored the protocol exactly to what your physiology needs. And the number one most common reason for why an IVF cycle will fail is that you were rushed. Now, sometimes this is the clinic's fault, and sometimes actually it's your fault. So a lot of people come in and they are very, very anxious, understandably, and very nervous and very driven to jump right into an IVF cycle because they think that the clock, the biological clock, is ticking very, very loudly and quickly. The reality is there are studies that show that even in women with diminished ovarian reserve, a delay of 6 months in treatment makes absolutely no difference in the outcome as far as the number of eggs, number of blastocysts, or live birth rates. What is important is taking the time to optimize all of the other things that we've just talked about in order to achieve success. You can't do that when you're rushed. If your clinic is rushing you, then they probably don't have your best interests at heart. If you're rushing it, you're really not doing the right thing. You want your clinic to take the time to understand you, your biology, your ovaries needs, your body's needs, your partner's needs, or the sperm source, and to make sure that every single element of what you're doing is optimized and perfected before you start, because that's going to increase your efficiency. It's going to have a very significant positive effect on your outcomes. So make sure that you are taking very, very good care of how your cycle is managed. You shouldn't have to advocate for yourself, but we do want you to be aware of the things that can impact your cycle and help you to make your cycle the most efficient, most successful it can be. If you have questions, don't hesitate to reach out. I hope you enjoyed this video. Make sure you click that like and subscribe button. We'll see you again soon.